Good afternoon. And today we have a very special program because this program not happen online like I usually do. Today, me and my guest, Dr. Galit Steinberg, actually in person. So today, my guest is Dr. Galit Steinberg, and we're actually doing it in the studio together. Good afternoon.
And I'm so happy to be here.
Yes, because we actually neighbors. But thank you very much to my audience. If you have trouble sleeping or sleep next to snoring partner, today we're going to talk about very unusual aspect of it, hormone replacement therapy, especially for females, because hormones definitely affecting the sleep, and vice versa, sleep also affecting the hormones. So today we're going to talk about that balance. If you are a medical professional who just like us, so passionate about putting a little pieces of healthy sleep together, this program is going to be for you, because we're going to talk about another solution what can be offered to the patients. And first of all, I want to introduce my guest. She is very experienced OBGYN with training in Columbia University, Columbia Presbyterian in New York City. And also she has a training in functional medicine. So she looked at this aspect from a lot of different angles. And I always talk about my book. So in my book, I brought up aspect of hormonal replacement therapy. And today we're going to find out the details. So my first question to you, Dr. Steinberg, please tell me, originally when I was growing up, or even when I was in my first medical school, and, we had some aspect of that in a dental school, we talk about a lot of, hormones are great, but maybe they're going to affect us so much in the long run. How come now hormone replacement therapy is become go-to treatment? Please explain to us what's so different about that.
So that's a great question, and I'm so happy you're bringing it up because the research has completely changed and the pendulum has swung entirely in a different direction. The original data, which kind of scared women off from hormone replacement therapy, was based on a huge trial done by the World Health Organization. And it was done on women that were older. So it wasn't just when they started menopause. It was already when they were in their later 60s. And it was also done on hormones that were not what we call bioidentical. It was done on synthetic hormones. So not the same type of progesterone that your body produces, but synthetic progestins. They also used different forms of estrogen that came from, they were called conjugated equine estrogens. So they were derivatives of horse urine, not bioidentical to the estrogen that your body produces. And that data, what happened, because it was in older women and it was used with synthetic treatments, they found that there were increased risks of breast cancer, increased risks of blood clots, stroke, and basically the study was halted, and many women after that, it kind of did actually a disservice, and they stopped using hormone replacement therapy. But then what we started to find were increased incidences of osteoporosis. There were increased incidences of cardiovascular disease in women. Women were also suffering terribly. Hot flashes, night sweats, poor sleep. That starts to have an entire effect on your life. That's not just a daily problem. It starts to affect your entire quality of life. So then newer studies came out using different forms of estrogen and progesterone. And the data started to skew back in the direction of using hormone replacement therapy because it started to show that actually the benefits outweigh the risks. So now we have different forms of estrogen. A lot of them, especially that most of us are recommending, are what we call transdermal. So rather than taking them orally, which then has effects on the liver and triglycerides, they go through the skin, but you still get the benefits of protecting the bone, protecting the mood, and I will go over the different types. And you have less incidence of, they're not showing increased risk of blood clots and stroke. Actually, there's going to be benefits to cognition. And the increased risk of breast cancer is minimal, which we can talk about later in detail. But I can show you some of the forms. So there are
very
patches
interesting.
available. Okay, this is just a generic patch, but there's different patches that come in different sizes that can be used either once or twice a week. And these are applied on the lower abdomen or the buttocks. There are gels available that people put on their inner thigh and can use this daily. And then for patients that either are not tolerating either of those methods, there are also some that some of us compound that comes in what we call a choppy click, and then they can put it on the inside of their arm or the inside of their thigh. There are also some oral forms that sometimes we need to use for patients that don't absorb transdermally, but we usually try to limit those as, again, the risks are definitely lower with the transdermal, so we prefer those.
Dr. Steinberg, I really want to ask you a very intimate question, but those questions come up in my practice. Tell me, can hormone replacement therapy influence female sexual health?
Oh, absolutely. And that's on multiple levels. So number one, if you're constantly suffering every day from hot flashes and you're not sleeping well, your mood is going to be terrible. Okay, we all know that what sleep deprivation does to mood. And I know you know that more than anyone as someone who specializes in sleep. So overall already, if you improve a female's mood, she's going to be more in the mood, okay, to have intercourse. Number two, without estrogen, the vagina starts to get extremely dry, okay, from the loss of collagen and elastin. That not only affects the vagina, it also affects the bladder and the entire genital urinary system. So sex now becomes painful to the point where sometimes people come in with, cuts in the vagina. So once you've had painful sex a few times, you don't want to have sex anymore. So that automatically affects the libido. And then sometimes also with the decreased levels of testosterone in the body as well, it can significantly affect the libido where, they can't either orgasm as quickly or they can't orgasm whatsoever. So when we start to replace all of those things, and again, you have to assess where is it coming from? Is it coming from the psychosocial aspect? Is it coming from the physical aspect? But when we start to fix all of that with hormone replacement therapy, well, their mood is better. They now are actually in the mood. It's not painful anymore, and it becomes fun. Why should menopause be the end of, great sex for women?
This is such a clear, simple explanation. But for our audience, how does this whole evaluation, considering what you do it from functional medicine standpoint, towards hormone replacement therapy, how does it work? Like when, female come to you, what exactly happened? How do you know if that's a good candidate for hormone replacement therapy or maybe not so much?
So that's a great question. And it really is sometimes, a mystery that we have to piece apart. So when people come in, I call, each one is a very personalized visit. There's no one size fits all. And there's not like you come in, you have hot flashes, great, here are your hormones. So we always take a very in-depth history to figure out when did this start, right? How long has this been going on for? What other symptoms are happening, right? Is it just that they're coming in and they're like, I'm not sleeping well? Okay, different story. Are they coming in and they're having hot flashes? Are they having night sweats? Are they suddenly complaining of recurrent urinary tract infections, right? They never had them before, and now suddenly they're getting a lot of urinary tract infections. Or suddenly they're having vaginal discomfort, whether even without having sex, like it feels itchy, it feels dry. I was, seeing somebody else, they kept treating me for yeast infections. Well, after a while, you start to wonder, is it actually yeast or is it, that there's dryness? Is something else going on? Sometimes, and I've seen this actually more frequently now, we'll have women in their 40s who start to come in with recurrent joint aches, tendon issues, inflammation that they were never having before. And when we start to check their hormones, we realize, wait a minute, their estrogen levels are extremely low. And now you start probing and you find out that there's other symptoms going on, and then you kind of have to put the overall picture together. So it's a lot of history taking, pointed questions, getting the bigger picture, and then blood work to see what's going on.
With the level. So
yes, blood work, yes, to check their levels. And then I also check their levels after starting them, because sometimes if they're not feeling well, it may actually be that they're not absorbing whatever we're giving them. So, it's important to check levels to make sure you're not overdosing, and also to make sure that you're actually increasing the levels of their hormones so that they're not just getting the symptom relief, but they're getting the benefits of the bone protection and the cardiovascular protection.
It's a very fine-tuning mechanism, not only with the level, but also maybe with the delivery system. So there are a lot of components to that.
Absolutely.
No, that's very interesting. But now I want to ask the question about sleep.
Of course.
How can hormonal replacement therapy help with the sleep? Of course, we know, I want you to show mutual dependency between sleep and hormonal level and sleep. So how does it work? Because a lot of people, in my practice, they have interrupted sleep. Of course, we can blame it on sleep apnea. We can blame it, it's never one thing. It's always multiple combinations. So tell me, from your functional medicine, hormone replacement therapy, viewpoint, how does it work with sleep?
So you actually brought two different things together. So there's the hormone replacement therapy component and how that affects sleep. And then from the functional medicine component, that's actually where you often would come in. And I'm happy to have that resource to be able to send patients to you. In terms of from the hormone replacement therapy perspective, so we're going to go back to, is the sleep interrupted because of the lack of certain hormones, or is it that the lack of certain hormones are causing issues that are interrupting the sleep? So oftentimes, if they're having night sweats or they're getting up to urinate because of the genital urinary symptoms of menopause, that's going to clearly disrupt their sleep. I mean, there's women who wake up every hour soaked. There's no way you're going to sleep well through that. So that's where the estrogen replacement potentially comes in. But we've also found that sometimes just replacing progesterone, which potentiates the effects of GABA, helps to produce a more restful, calming sleep. So again, it's the balance of, is it the symptoms that are waking them up, or is it that lack of progesterone that's inhibiting that calming, restful sleep? And then again, from the functional perspective, let's say we've optimized all of that and they're not sleeping well. Then now we have to figure out if there are other risk factors, right? Are they mouth breathers, right? Is there some component of sleep apnea coming on? Are their cortisol levels elevated because of stress? Is it that they can't calm themselves down before they go to sleep? That becomes a whole different picture of other things.
But, in general, it takes so much factors into account. But I would like to ask you, who are not a good candidate for hormone replacement therapy? Like what factors, like genetic, lifestyle, and metabolic, if you can outline, red flags, I would say.
For sure. So again, it's constantly changing with the data. So number one, anyone with a personal history of breast cancer is going to be a red flag for hormone replacement therapy. However, they are now working on getting the black box warning off of vaginal estrogen so that at least we can help those women with the genital urinary symptoms of menopause and treat them with vaginal estrogen. But in terms of systemic hormone replacement therapy, that's still a big no. There used to be a question with patients with stroke or blood clots that used to be a big no-no. I would say that with transdermal, it would now, depend on the patient. Same thing with history of migraines with aura, where it used to be a big red flag, and now it becomes a conversation, again, of risk versus benefit, conversations with the neurologist, working together to see what were the risk factors for causing the stroke. A lot of my patients actually with migraines with aura have had less headaches once they started transdermals. But again, that's working closely with their neurologist, assuming that they're, comfortable with it. But those patients, I would not give them oral hormone replacement therapy. That would be strictly limited to transdermal. And then patients with a family history of breast cancer, that becomes, again, a conversation with the patient. And I think everything is risk versus benefit. So the way that I explain it is we discuss, what the elevated risk is and how that would elevate the risk even more for them because they already have an underlying risk versus the benefit, right? So if they're just having, mild symptoms and we can treat them with something else, then great, right? We're going to do everything possible to minimize their risk. But if we can't, and it's affecting their quality of life to the point that they can't function, well, then that becomes another conversation. And, where is the benefit versus the risk?
Yeah, no. What about metabolic factors? What about somebody who suffer with the weight excess?
So that is, problematic, as we know that adipose tissue in and of itself produces exogenous estrogen, which automatically, is a risk factor for not just breast cancer, but multiple cancers. Again, it becomes a conversation. Sometimes the hormone replacement therapy actually helps them work on their weight loss. So I think that if they're working on the weight loss, diet, lifestyle, some of them may need, GLP-1s, depending on how obese they are, then they would potentially, be candidates for hormone replacement therapy. I think I would have a very hard time starting somebody who was not, ready to work on their weight whatsoever because of the risk factors.
Yeah, no, that's a very good topic. Of course, a double-edged sword. I really like that expression. We always, walk on the edge of that sword, and we have to make a right decision. And it's sometimes not easy for the doctor, taking a lot of things into consideration. But just like any treatment, this is not a unicorn. This is not a magic wand. This is, this is very good way to approach a lot of, limitations, but you have to be in a certain shape, and, and it's require fine tuning with the great specialists like we have here. And Dr. Steinberg practice called Younique, right?
Younique Health, yeah.
Younique Health. And I like how you put it with Y. And you can find information about Dr. Steinberg underneath this interview. And if you have questions, you can get in touch through the website or visit for the appointment and have evaluation and have that heart-to-heart conversation with somebody who definitely going to listen and understand your concerns and, kind of help you to evaluate that double-edged sword or, weigh the risk and limitations of this treatment. And yes, we are, I would say, fortunate what medicine got to that point, what we can fine tune the treatment and, based on the blood work and symptoms, understand, okay, if it's working for you, it needs modification, maybe it needs a different form of delivery or different dose. So, I recommend you to get in touch with Dr. Steinberg. And thank you very much for, for this very detailed explanation. But last question I have about, hot flashes at nighttime, awakening, how hormone replacement therapy can, I want you to repeat, I know you mentioned about GABA, improve the architecture of sleep, reduce nighttime awakening, and address the hot flashes, what a lot of people find a lot of suffering with. Or at least I see that in my practice.
Oh, so yes, absolutely. So again, there's hot flashes that occur during the day, and then there are the night sweats where basically estrogen, the drop in estrogen affects the body's temperature regulation. So the estrogen really helps with the hot flashes during the day. It also can help with those night sweats, which again, do wake people up. And then once again, there's that progesterone component. And that's why it's important to balance, because initially the reason that we have to prescribe progesterone with estrogen replacement therapy in anyone with a uterus is that if we don't, it can increase the risk of endometrial cancer or cancer of the lining of the uterus. So patients must take progesterone if they have a uterus to prevent that risk. However, I can tell you that in many of my patients, whether they have a uterus or they don't, I recommend that progesterone because of its positive impact on sleep. Okay, because it creates a more calming, restful sleep. It almost has this like sleep effect. So they're supposed to take it right before they go to bed, and that one is given orally. And again, sometimes we have to titrate the dose because some people are more sensitive to it than others. And it helps them with their overall, sleep quality and providing a much more restful sleep. And then they potentially don't hear their partner snoring.
So thank you very much. Like this particular, treatment can help us to stay young and rest for a long period of time. So thank you very much. And I find it so much fun to have a conversation in a physical closeness. So thank you very much for that, for coming to my studio.
And thanks so much for having me. I love that, we can work together and help patients with so many important things, but sleep is absolutely one of the most important things because it affects your cognition, it affects your mood, and affects the way you function, throughout the entire day.
Thank you very much.